Welcome to Conversations in Integrative Medicine, sponsored by Natural Clinician and the Holt Institute of Medicine. In this module I'm going to talk about diagnostics in integrative medicine and start by saying the integrative medical practitioner and the practitioner of natural medicine have not turned their back on standard medical diagnostics that are used in conventional medical practice. But let's talk about the obvious history and physical diagnosis. It shouldn't differ materially in integrative medicine practice, but in integrative medicine it's generally more expansive and holistic. In my own experience, I really find a lot of history and background information from the other staff within the clinic. And this is common in medical practice, where perhaps a mature female feels much more comfortable speaking to another mature female and will address spontaneously issues that they may not address in a consultation with an andropausal male. So we can see preference here in terms of gender for client-healer relationships. Many other factors operate, personality, physical appearance, all sorts of issues, the context in which questions are asked can all alter responses. So it's clear and fairly obvious how the integrative medicine practitioner will look at the patient. They'll look at socio-behavioral factors, very detailed lifestyle history, very detailed assessment of normal body functions such as menstruation in women, transitions in life, sleep patterns, all of these things that are extremely important, well-defined determinants of future health. Now, in terms of physical examination, again, integrative medicine really goes to the classic model of eliciting symptoms and signs. So that doesn't really and shouldn't differ. But where there is some difference, perhaps, is in the extent or selection of laboratory testing. Certainly the integrative medical physician will tend to look much more at things like nutrition, diet, food tolerance, food allergy, certainly evidence of body toxicity that is sometimes not assessed by the conventional physician. So things like heavy metal screening, etc. are often part of a routine integrative medicine assessment. The other thing that's extremely important, depending on the area in anti-aging medicine, hormonal profiles are often checked, and assessments for whether or not the administration of supplemental hormones are appropriate in anti-aging medicine is a growing discipline, a growing area of great importance. But obviously things like X-ray, etc., MRI, CAT scanning, functional testing are all basically part of both conventional and integrative medicine practice. But the integrative medical practitioner may, like the naturopath, focus much more upon gastrointestinal health and look for conditions like leaky gut syndrome. So it goes on, but in essence one of the mainstays of really diagnosis and intervention is looking at domains of lifestyle, like psychological well-being, nutritional status, exercise. All of these factors come into a more holistic assessment. So it's against these background that we start talking about what differences there may be in the ordering of tests. Well, some practitioners of natural medicine don't like exposure of their patients to X-rays, and when it comes to mammography, may want to use thermography. But of course we now have an argument as to whether or not things like thermography are as accurate diagnostically as standard carefully done mammography. So in essence we do get into some areas of difference of opinion here, and there are other types of testing that are done, like oxidation or oxidant status of the body, which may not be done in conventional medicine. And we now have innovations where we're using more biocomputing type technology to use information systems that combine quantum physics and information technology that interface with the patient to try and have a kind of conversation. This sounds a little bit like Star Wars. It sounds a little bit way out there, but we have increasingly in clinical practice the use of these types of biosurveys or bioscans. Many of them rely upon a galvanic skin response or electrodermal activity, which can be transmitted into special software. It can then be analyzed for coherence patterns, and a kind of conversation is alleged to occur between the patient and the microcomputer, and this can be used for guidance of things like food allergy, or even in some circumstances guidance to use things like dietary supplements. But of course there's a lot of skepticism about this approach, and the bottom line is that we still are far away from the day when a machine will be any substitute for the intuition and skills of a well-trained healthcare practitioner. Notice how I'm willing to keep using the word healthcare giver, because in essence we're seeing these days that medicine isn't specifically owned by the MD or their associates. We have a lot of healthcare consumers that go primarily to other types of physician with other disciplines like naturopaths, chiropractors. And in fact, again, arguably, this is more portability of healthcare and more cost effective. In fact, there have been some studies showing that utilizing a chiropractic facility as a primary care facility may be more cost effective than using a standard physician's office. These are obviously confrontational types of statements, but I can assure you that the literature seems to suggest some of these things to be the case. And in fact, if you look at the ability of nurse practitioners to care for patients, they come up tops and certainly completely equivalent in many ways to standard MD care or physician care. So you can see we have all of these changes occurring in medicine. We have obviously diagnostic interventions that differ, and obviously interests and various areas of emphasis placed by an integrative medicine physician on certain lifestyle issues. For example, conventional physicians often don't acknowledge even the disorder of candidiasis. They just don't believe that that is anything more than a commensal organism in some circumstances that, presents itself with an opportunistic infection. But there's no doubt that we have many chronic diseases that are not effectively managed by pharmaceuticals, and obviously people are looking for alternatives, but they're looking for viable alternatives. And of course that's all down to research in integrative medicine, which is still embryonic and in its infancy. And we shall be challenged always about the level of research in integrative medicine, because what drives the economic model in healthcare is obviously things like drug prescription and surgical intervention in a system in the United States which is fee-for-service. And so much medical practice is orientated to interventions and diagnostic interventions where there are substantial payments for these services. So unfortunately it does get down to economics, but it also gets down to politics, and the most important thing is really the consumer lobby. So thank you for listening to this module, which gives some examples of differences in diagnostic approach. Thank you for listening.